In a pandemic, herd immunity is the holy grail, the point at which enough people are immune to protect those who are not. It can come from a protective vaccine or after enough people get infected. Now, a controversial declaration by a group of scientists suggests almost all schools and businesses around the world should reopen to expedite immunity from COVID-19. Other eminent researchers are aghast at an idea they say would cost more lives. Eric Sorensen reports.
When President Trump encourages crowds to gather without requiring masks or distancing, he is, in effect, promoting a strategy to speed up transmission of the novel coronavirus to achieve herd immunity sooner.
It happens. People have it and it goes, get the kids back to school. We got to get the kids back to school.
The approach would drop restrictions and allow the virus to run through the younger, stronger population while protecting the elderly and vulnerable. White House officials have cited the Barrington Declaration, signed by dozens of doctors, stating in part, those who are not vulnerable should immediately be allowed to resume life as normal. This Canadian doctor co-signed the petition.
I would like to see healthy young people get back to work because they're very low risk of COVID-19. The central point of the declaration is that lockdowns have the potential to cause harms not really related to COVID-19.
Harms such as delayed medical attention for other illnesses and mental health problems from social isolation.
I think that this plan would cause far fewer people to die overall, once you take into account suicides from unemployment.
But a wave of international researchers has responded with alarm to the idea that the vulnerable can be cordoned off from young people as they acquire immunity. Writing in The Lancet, it is a dangerous fallacy, unsupported by scientific evidence.
We are an incredibly interconnected society and intergenerational society. So for this, notion that we can, in some artificial way, segregate generations, it's utterly ridiculous.
Manaus, Brazil has been cited as a real-time example where herd immunity developed. After a tragic number of COVID-19 deaths, there was evidence the population had achieved a level of immunity around 50% or higher. The beaches opened up. Life largely returned to normal. But recently, cases of COVID-19 have surged once more, and researchers have raised the possibility that immunity, the antibodies after infection, may not last.
This is a disease or an infection that hasn't been around for a year. And so we have no idea about the durability of immunity after having been infected.
The World Health Organization is adamant that trying for herd immunity before there's a vaccine would do more harm than good.
Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak. Allowing a dangerous virus that we don't fully understand to run free is simply unethical.
There's no modern playbook to ameliorate the health, social, and economic harm from COVID-19. And absent a vaccine, there are no easy answers. Eric Sorensen, Global News, Toronto.